will help you with that. My name is Matthew Bryant, and I'm an Albert Einstein Distinguished Educator Fellow. I've been working in Mr. Grijalva's DC office since last August. And so it's pretty great to have all of you here to talk about schools reopening here this fall. So I'm just going to quickly name our participants and then turn it over to Mr. Grijalva for some opening remarks. And then after that, we'll go through all of our panelists' opening remarks if they have anything to say, and then we can have a discussion about opening schools in Arizona. So thank you to Dr. Teresa Cullen here from Pima County Health Department, and Mr. Stephen Holmes from Sunnyside School District. He's the superintendent there. Mr. Jason Freed from the Tucson Education Association, Monique Peralta from Tucson Unified School. She teaches 4th grade, and Cameron Taravati, the principal at Wakefield Middle in Tucson Unified. So thank you to all for being here. Mr. Grijalva, would you like to start us off today?
Thank you very much, and let me thank all of you that are joining this discussion. It's a very important discussion that we hope to disseminate, gather information, share that with my colleagues in Congress. And I say that because as we go back, and I have to return on Sunday, dealing with one of the things that's being negotiated besides all the other pieces of legislation we'll be dealing with is the Senate has made some overtures and some discussion about their willingness to deal with parts of the HEROES Act that we passed in Congress. And the 3 areas that seems to be a focus on are the issue of unemployment, hardship support for American families and workers. The other issue seems the constant issue having to do with with testing, tracing, and response to healthcare providers in the country, and then the discussion that is now front and center, and it's the discussion we're having today, is the supplemental support that Congress should be providing to school districts as the discussion continues to ratchet up as to the opening of schools and the resources that are going to be needed to that end. So, I think there's general agreement that our public schools need to open. I think the question is when and how that should happen. I don't think the decision can and should be politicized. Playing politics by demanding full-time in-person instruction this fall is one thing, but safely reopening it for me is the only option that's available to all of us, and that involves supporting students that need to be in school. All of them do. That boosts economic recovery, and I think it's important that we localize decisions between parents, teachers, administrators, public health, and the public health community and the medical community, and talk about what the best would be in terms of what needs to be done for a safe, healthy opening. And safe for the students, the kids, safe for the people that work for our school system, and safe in terms of preventing additional community spread. Arizona is in the grips of the pandemic in a very, very real way, and in a very I think to some extent a very scary way, and so how bringing the pandemic under control, controlling the spread, has to be a priority, because the correlation between testing, tracing, treatment are linked to the safe opening of our schools. And the backdrop to this discussion about schools openings is the abject lack of a national response, a strategic response both nationally and here in Arizona. And I think the consequences are obvious. I want to quote from a letter that 60 school board members sent to Governor Ducey and to the congressional delegation. And the quote that stuck with me is and I want to repeat it, is we all appreciate the decision to require five days of on-site learning to assure families have a place to send their children so they can continue to earn an income and financially contribute to our economy. This decision is inequitable and greatly impacts our poorest communities the most. The majority of families in our wealthiest neighborhoods will be able to work from home and continue to deliver online classes to their children remotely. Working class families do not have this luxury, and schools in some of our most vulnerable and poorest communities will see the largest class sizes and undoubtedly a larger number of COVID-19 infections within the community and fatality. I want to emphasize that point. I think that an equitable opening, I think involves the health and well-being of everybody involved in those schools and in our school districts, parents, community, families, teachers, staff, and of course, the children and the students. So when we return, those will be the topics, and your input today is not only a helpful guide to me personally, but as we disseminate that, a guide to how this should be done, when it should be done, and the kind of resource support that is going to be needed. You know, Governor Ducey has a target date of August 17th, some discussion, but nothing final as to moving that date back into October. We haven't heard anything definitive. The push from the administration nationally to open the schools this fall, all are now kind of coalescing on the discussion about whatever it is, what is the support that schools are going to need, what are the cautions that schools have, and I think the best way to do it is to localize and to allow parents, community, teachers, administrators to be the guidepost and the guardrails as to how we, as a community, open our schools and return a very essential function to our communities, which is our schools. Let me thank all the participants. I know all of us are busy, and in particular, let me begin by Matt. There's no sequence as to who we introduce and how, right? No?
That's correct, sir.
Thank you. Yeah, please.
I had a plan, but it doesn't particularly matter to me. So whatever you think.
I'm going to follow your plan.
Okay.
So your comments, in 4 to 5 minutes, so that we can have an opportunity to ask questions and Matt can facilitate a discussion, trying to get as many perspectives as possible. I've had opportunity to talk to parents, had an opportunity to talk to teachers, school board members, health providers, about the issue of the school opening. And being on the Education and Workforce Committee, being a senior member of that, is particularly important to me that if we're going, any opening be done right, and with the safety and health of the kids and everybody involved being put number one. Let me begin by introducing my friend, Superintendent of Sunnyside School District, where I went to school. And I'm not going to say that Mr. Holmes was superintendent when I was in school because that would be, but anyway, this is Steve Holmes. Sir, thank you so much for taking the time, and the floor is yours.
Thank you, Congressman Grijalva, and thank you for the invite and esteemed panelists as well. I have 3 points that I think are important as we're looking at opening school ourselves here in Sunnyside. As you know, I, along with our governing board members and all of our teachers, really want to get kids back to school. I mean, that's critically important, but we want to do it safely. Some of the points that I'd like to make that I think have been missing factors in our ability to do so is that we really need a set of health metrics that drive a phased-in approach to students coming back safely along with staff. I think there's enough metrics out there, particularly that can drive the decision. There's a lot of health experts, and there's a lot of knowledge about the spread of this disease that seems logical to look at places or areas where the spread is greater and look at what does that percentage have to be so that you can begin to bring back students, and then more importantly, what are those metrics that drive those decisions? And we have yet to see any logic applied to health factors and a phased-in entry to school, which would be important to have as one. I think two, this idea of testing and the lack thereof and tracing is critical to be in place. I know we have our administrators and our 12-month employees here now, along with some classified staff that will be coming back shortly. And in the short time that we've been operating with a short staff, just trying to actively manage testing for those who feel they've been exposed has been a nightmare. It's gone from 2 days of getting or getting an appointment and getting results back to now being closer to 2 weeks, a week trying to get a test and then another week trying to get results. If that's the way we're going to operate, we cannot open school and realistically have people in and out just because they're trying to get tested and trying to find out who's been exposed. So that's a bigger challenge that needs to be addressed. And then lastly, I think one of the big concerns has been childcare and why the need to open 5 days a week. I think we have to get creative with local businesses. There and our footprint, Congressman, there's a lot of empty buildings here. We're in an industrial area that could be utilized for makeshift childcare opportunities if we partner with Boys and Girls Clubs, YMCAs. I think there's creative options for childcare that does not have to be schools bearing the burden of that. I think there's enough ways in which we could look at incentives for businesses along with local partners to really look at creatively around childcare options. So those are just 3 points that I would like to make just as we start the dialogue.
So much. Excellent. Let me introduce the new director to the Pima Health Department, assuming that a very important position as the jurisdiction dealing with public health in Pima County and our communities. We're here in Pima County, we're very fortunate to have her leadership in that department. Director Teresa Cullen and Susan Goodman that is also with her. Doctor, the floor is yours as well.
Great. Thank you, Congressman. Thank you for the other panelists. Let me talk a little bit about the work we've been doing about school reopening. It has been a high priority for us. We have developed approach to that, which is initially framed by looking at what the principles of reopening should be. And some of them have already been alluded to, that there's a commitment to equity, there's a commitment to safety, including testing, case investigation, contact tracing, and all of that being done in a timely manner. There's a commitment to the students, families, and community and the potential impact of the decisions. In order to do that, we have focused on developing some health metrics. We agree with the previous speaker about how critical they are. We've looked at disease burden and disease transmission, clinical support that's available in the community to ensure that if and when individuals get ill, including family members, they can access appropriate care. And we've looked at the public health support and infrastructure. We believe there's many other areas that are important for the schools to consider, and we've been pulling together the information on that related to things like restrictions in visitors, what's appropriate education monitoring and screening of staff, appropriate education monitor screening and cohorting of students to decrease disease burden, the availability of supplies and changes in the environment as well as PPE, the need for adequate infection control and prevention, reporting. Do people understand what happens if there is a case? What is public health policy related to that? When is it appropriate to close a classroom? When is it appropriate to close a school? This would be obviously after schools have reopened. We've been working with the Council of State and Territorial epidemiologists to try to define what does it mean to have a cluster or an outbreak in a school, and what does it mean to have a cluster or an outbreak in a classroom, because either of those designations may result in either a classroom or a cohort of students and or a school closing. In terms of where we are right now, so all of that is in development, but I do want to talk a little bit about where Pima County is right now. We are in an accelerated transmission phase. That means that we have seen our numbers continue to increase. They have not plateaued yet. We are in a phase where our hospitalization and our clinical care system is taxed. We have many days, what we call a static number of hospital beds, and many times that number for ICU beds is less than 10 for the entire county. Granted, the vast majority, almost all those beds, are in Tucson itself within the city limits. And finally, to go to what the previous speaker did talk about, testing, case investigation, and contact tracing, we are not in the area where we need to be in terms of the timeliness of that. A new article just came out in Lancet in the last day or two that indicated how do you get your R naught, which is how quickly somebody infects another person, less than one, which is what we want. That means that each of those segments would have to be a day. So we test you, we get the result within 24 hours, we case investigate within 24 hours, we contact trace within 24 hours, and we isolate people appropriately. Those are all needed to ensure and increase the safety of the community. But we are actively working on trying to give and develop the guidance to the schools and the school superintendents so that they will be in a position to make the best decisions for their district. Thank you.
Any a teacher, 5th grade at Carrillo, where my grandbabies, one of them now goes to school, the other two did too. Monique Peralta, and excellent teacher. And thank you for the time. And the classroom perspective is very important, and I'm glad you joined us. Monique?
Thank you, Congressman Grijalva, and thank you for inviting me to this discussion. As a teacher myself, and I know many teachers that I have talked to, the number one concern that we have, or I have, is the lack of not knowing. And I think the past two speakers, Steve and Teresa, talked about when do we know it's safe to go back? When are teachers going to find out how it's going to be when we get into the classroom? There's just so many unanswered questions right now that I think is bringing a lot of anxiety to teachers and making them wonder, how are we going to keep our students safe when we get back into the classroom? I know I want nothing more than to be with my students in the classroom, teaching them in person, but I can't see doing that if it's not safe. And at the same time, we feel like, what is safe? We haven't really told what the numbers need to be in order for us to go back into the classroom safely. And we hear that, we can go back in when it's safe, but we really need to know, what does that mean? And we can't just open schools on the fly just because people are saying that schools need to open. I think it's something that everybody needs to really think about, and we need to think about, we can go back to school, but we need to look at the science, and we need to leave the politics out of it, because we're talking about our children, and that should be the number one concern. How can we get back in the classroom? Teach our children, because we know that in-person learning is the most important learning, most effective learning. And how can we get there safely to know that they're going to have what they need in order to thrive as learners, and for us to catch them up? I mean, we can catch them up once we get back to school in person. We will be able to catch them up, but there's things that we need to know as teachers, so that we can start planning, that I feel like there's just no information out there for us. So I think that's just a constant thing that teachers worry about. I know one of the biggest things teachers worry about is, how is the budget going to support the schools as far as being able to be safe, so that they can purchase the things that they need, like face mask, hand sanitizer, additional sinks in schools, thermometers. We know that not every school is going to be checking temperatures. Some schools are purchasing them. But as that all comes down to the budget, we just need a lot of support from our state and our federal government. And we know that the districts and the superintendents are doing everything they can with what they have, but we need support. We need support from local and federal government. So I think that's the main concerns that I have, and I know many teachers have as well.
Wakefield Middle School, that's reopening. And Mr. Tarabati, did I say it correctly, sir? Welcome. That's my grandson Lito will be going to that school, and I want him to go. I want him to be in person, and as a opening up a school, your perspective and as a principal as well is very important. So the time is yours, sir.
Thank you, Congressman, and just thank you, panelists. It's a pleasure to be here today. Yeah, just a few things. So I think first of all, this is just a real concerning issue. It's a real concerning time. You know, yesterday we had over 130,000 cases of COVID-19 in Arizona. Many of those cases are still active. So as we see those numbers rise, so does our anxiety, and so does our fear, and so does our concern. That said, I think we need to know that we are committed, all of us are committed to education and committed to making sure that, you know, the instruction continues for kids in a different modality or the same modality. Just depends on what we're able to do as a community. And as rates rise, you know, we really have to reflect on that, and we really have to kind of reflect on science and trust science and look to the organizations like the Pima County Health Department, the CDC, for guidance in terms of when is the right time to go back, and how does that look, and what can we do to meet the needs of learners. One of the things I think that you know, you spoke to, Congressman Grijalva, was this issue of equity. And so Wakefield is in zip code 85713. And so just to the south of that is zip code 85714. And these are two zip codes that just really have tremendous need. And we look at COVID-19 data, what we're seeing is these are quote unquote like red areas. These are areas that are just blowing up in terms of infection. These are also areas where we're not seeing just the testing, treating, and tracing that we need to see in order to really re-enter school in an effective way. An additional thing that I think we have to consider in this area is this is an underserved community, and often we see just the working poor in this area. We see families that are struggling, and we see families that need just schools to open, and we need just they need help. That's the bottom line. And so and I also think that they need help just helping to close the digital divide, because as we know, this area is really just a digital desert. And so I think we need to continue to partner with just those organizations and companies that offer broadband and get internet in the homes of the students that we serve. And so it's a scary time for sure. It's a concerning time. And I think that in the end, I do think it'll allow us to kind of truly to use kind of the buzzword that's out there, just a reimagined sense of what school looks like. I think for so long we've done school kind of a specific way, and now we all know that, you know, things can change on a dime. So how can we use maybe some of the new tools that we've been really forced into to provide some amazing education opportunities, and really just, you know, kind of rethink how our approach is to school and how our approach is with families and kids.
Mr. Jason Freed, someone I've known and someone who I've worked with on education issues, representing the Tucson Education Association and its membership. Mr. Freed, time is yours.
Thank you very much, Representative Grijalva, for hosting this roundtable, as well as the inclusion of the dynamic leaders and educators. I'm truly honored to be just part of the space that we are all occupying at this moment. Just as a background, I'm the son of an educator, TUSD product, kids in TUSD, and even one of my daughters has said she's planning on becoming a teacher. And so my roots are very deep in education and in Tucson. I'll add to my 16 years of being in the classroom and talking with other educators and with other parents that there is true concern about safety for students and colleagues. And I'll add that online education is extremely challenging to try to engage our students, and yet it's critical for us to be engaging our students in that online instruction as we open up the school year, and not just for a short while, but for an extended period of time. Survey after survey is showing, whether it's national surveys or local surveys. There was an Arizona survey surveying parents that 3/4 of the parents do not believe that our schools will be safe or that we'll be able to follow the CDC guidelines. And so 2/3 of the parents absolutely believe that we should not be opening our schools. Another survey hosted by the Arizona Education Association showed that over 80% of all educators believe that we should not open our schools yet and that it's not safe. And so what I find frustrating and really puzzling as I talk to my colleagues and other parents in the community is, why is it that we're discussing opening schools just because a governor or a president believes that's ideal, when the community and the folks that are supposed to be served by the governor and the president are simply saying, no, it's not safe. To be clear, and we've heard obviously from experts, and we all know this, masks are simply not enough. 6 feet away from students is not going to be enough. Limiting movement through schools is simply not going to be enough. And so we've got to talk and be honest. I'll tell you, Representative Grijalva, for my entire life, I believe education has done its number one job, which is not actually about teaching. It's not about instruction. The number one job that we have as schools and employees of those schools is to keep our kids safe. That's our first priority. And secondarily, we look at education and tertiary other issues. But our first job is to keep our kids safe. Opening up any school right now, no matter what measures are taken, is simply not safe. So that needs to be made clear at the federal level as well as at the state level. There is, all we can say, if a parent were to ask me, all I could say is, we are going to mitigate, but that's all we can do. I cannot say to a parent that it's safe, and I will not send my kids, even though they are starved to get back to school, and my colleagues are starved to be in front of their students. Nobody wants to be in an unsafe environment, and we are doing a disservice, and we are truly not doing our job as educators if we open up schools when it's clearly not safe. So then we start talking about what does safety look like. We've heard from experts already in this panel and elsewhere that we need to see a rapid decline in the number of cases and deaths that are connected to it. I completely agree, as previous speakers have said, that when we look at our poorest communities, those are going to be the ones that are going to be hit the hardest, and we're going to see highest number of cases and the highest number of deaths. And so it's simply not acceptable to put any kid in that environment, certainly not our neediest of kids. And so that's what I would urge, is that you continue to do the work that you've done, but that as you're doing that, you set the priority first, second, and third is the safety of our students and the teachers and the staff that are working with those students. And then we start talking about measures that we can use to try to mitigate. But again, the rampant nature of this is one that truly terrifies me as a parent, and it terrifies me as a teacher, to say, how are we going to in any way keep our kids safe? And so until we have anything that looks like significant reductions in the number of cases and deaths and a better course of action than we currently have when somebody does get sick, there is no way that we can keep kids safe if we bring them to school. So that would be my plea as a parent and as a teacher, talking to lots of parents and lots of teachers, is to say, let's accept that we need to do an online-based model, even if that's not what most teachers and students want. It is the only way to keep our kids safe. And let's have a conversation down the line about how we could open up schools in a safe manner. But today, we cannot keep our kids safe. And we know that, and every measure that we take would simply be to mitigate those measures. Thank you.
Thank you very much. And I'm going to turn it over to Matt to kind of move the discussion. One of the recommendations, and when Mr. Holm has an opportunity, one of the recommendations is the whole funding scenario, where the schools find themselves in a catch-22. Enrollment, how many, and how the budget from the state is allocated along that, and no discussion about suspending that until there is a positive plateau in terms of the spread and infection rate and mortality rate that's going on with the pandemic. I think that kind of puts school districts in a catch-22, because if they don't respond to that demand, then you're losing money, and then deeper and deeper kinds of reductions within the budget of the school district begin to happen. So I don't know how you solve that other than suspending that, but I mean, there hasn't been that much discussion about that. Matt, do you want to begin that? And I appreciate it.
Sure. Thank you, Congressman Grijalva. Yeah, a number of you mentioned testing, and I know that a lot of the CDC recommendations involve things like keeping students apart, but in cohorts, and assigning seats so that it would be easier to contact trace if one of them was found to be COVID positive. But it seems to me that you can't contact trace if you don't have testing in place first. You have to know who to trace, and who's infected, and who might be carrying things that are asymptomatic. They might be positive but not even have any symptoms. And so I just wondered if maybe Dr. Cullen maybe could start and talk about what's needed in terms of testing in schools. Should we be looking at things like testing students and staff weekly, daily? What's the best?
I wish so thank you for that question. I wish I had a scientific-based answer. I don't have one. Let me talk briefly about what's happening with testing in Pima County, and then this cascade of case investigation and contact tracing. So as many of you are probably aware, last Friday, but really in the last 2 days, we've stood up an accelerated testing center at the Keno Event Center. We believe that will be able to handle 1,000 tests. Right now, I think it's at 700 for today, so we should be able to quickly get to 700. That's a new testing center. There are also multiple other testing centers in Tucson. There's approximately 20. Most of them are not run by the county. We run this one and 2 others. We have provided aggressive and recurrent long-term care testing. In terms of schools, the reality is we don't know what we should do, especially with young children. So what we know is that if an adult or someone else tests positive, we need to be able to do contact trace, case investigation, and isolation. So people need to go somewhere for 10 to 14 days and isolate from others. Now, obviously, some people can do that in their home. What we believe will happen in schools is that there's no recommendation right now for routine testing in schools, either for at the time of return and reinitiation of school, or during the school year. So unlike what you're seeing, for instance, with some of the athletics, especially professional athletics, you're seeing people tested repeatedly. That has not been a scientific recommendation for the school-based systems. The more important thing, I think, given the lack of that recommendation, which also reflects the lack of science, right? That's one reason there's not a recommendation, is to make sure that if anyone is symptomatic or exposed to a symptomatic person or a case, that they can get testing. And once again, the recommendation for that would be testing within 24 to 36 hours.
Thank you, Dr. Cullen. What are your plans now? And this really goes to any of the administrators. But what are your plans now? What are you thinking about what opening school will look like? That is, when it happens. What do you expect students and staff to be doing daily?
Yeah, from the Tucson Unified School District side of the house, there was a plan presented to the governing board in terms of what reentry looks like. So we surveyed our students and our families, and basically we determined that 50% of the population is wanting to engage in online instruction, and 50% of the population is wanting to engage in in-person instruction. But that said, all of it will be done through the online vehicle. So if you can envision for a second, students actually going to a site, going to a school, going into a classroom with no more than 10 students per class, socially distancing them as best as we can, and then putting them on a computer so that they can connect with their teacher virtually. So that was the plan that was presented. The other piece that I think, just to kind of piggyback off of Ms. Collins' points in terms of testing is, I think that what we're all charged here with is mitigation until treatment. So by that, I mean, we're all charged with kind of keeping the peace in a COVID world, making sure that we try to keep as many people as healthy as possible until a vaccine comes or until treatment comes. So I think that's something that we have to keep in the back of our mind. So when we talk about reentry, we really look at those pieces in terms of having this blended model where we offer, virtual instruction or online instruction as well as in-person instruction, but really trying to reduce the amount of in-person instruction as much as possible so that we can really engage in some of these mitigating systems and mitigating structures until a treatment or a vaccine comes.
I'll jump in just as a superintendent of a local district. Under the current executive order in Arizona, what schools would look like if forced to open on August 17th is just, I can describe as chaotic. There really is nothing in the science that supports currently bringing students back 5 days a week. Our inability to manage the CDC guidelines as a floor to safety and the lack of testing is going to be a nightmare. And so what we're planning, and I think most local districts are, just to start online and really try to purchase enough technology for students and really try to make sure teachers are up to speed on the curriculum and its accessibility online. There are districts throughout the county who have been using technology as a means to deliver instruction for some time who are better off. And there's others who have scrambled over the last few months to make major purchases who are going to be challenged by the online environment. And so there's going to be great variability amongst districts in the current state that we're in. But I still think, given the health risks, anything that requires us to go back to school in the current conditions is going to be chaotic at best.
Matt, if I could piggyback off of that, because I think there's also one thing that Mr. Holmes would and all the educators would agree with, and that's there's a missing element in all of this, and that's the social emotional connection and the behavioral health connection with all of our students. So, Mr. Freed had commented earlier just about the role of schools and the role of teachers. One of the biggest roles of all teachers is just to create relationships with kids so that kids feel like they have a safe space to learn. And so the thing I think that we're all really just in the back of our minds that we're fearing, that we're dreading, is we know that we're all charged with keeping not only kids safe, but adults safe. So that word of just it's chaotic is absolutely right on. The other piece of this is for all of our kids and families that are feeling anxious, now they feel more anxious. If they had depression, they have more depression. So there's a lot that's going on out there that I think that we just really need to have some larger conversations about, not only just among the school districts, but also with the CDC, also with Pima County Health Department, also with Arizona Department of Health, in terms of how do we reach those families and those students that are struggling through those kinds of mediums.
Thank you. Yeah, it really it really seems like it's. Oh, go ahead, Congressman.
No, I'm done. I just commented that was a good point.
Okay. Yeah, I was just going to say it was. It really seems like what the congressman was saying earlier. It's a catch-22. There are these competing things. You want to keep kids safe. You want to support them emotionally, and you want to support their education. And I think we all have. I think you all said that in person is the best way to do it if we can do it safely. And that's the challenging part in this whole process. I wanted to ask too. So it seems like even if schools open in person, whenever that happens, that it's likely that they may not stay open depending on what happens with the virus in that school. And so maybe the teachers could chime in here and just say what are you thinking about planning? What are you thinking about for your students going from remote learning to in person, back to remote, and possibly back and forth a few times? What are you thinking about those challenges?
I think it's going to be very challenging for our students to be going back and forth, but we know that's a possibility of what will happen when we open and the virus continues and comes back. That's why it's important that we don't go back until we know that we have the virus under control and keep students' health and safety number one. Someone else touched on this, the social and emotional learning that teachers are going to have to be trained in to deal with the students. I mean, when the students come back to school, they will expect to come back to school the way school used to look, and they will be excited to come back to school. And once they walk through that building and they see that things will not be the same, we are going to have to deal with that, and we are going to have to make it the best learning environment possible for them. But they are going to have a lot of stress and anxiety, and I wouldn't be surprised if they didn't want to come back the next day because they're used to school being that place where they're working with their peers, they're having fun, they're playing on the playground, they're doing hands-on activities with their classmates, they're having discussions, they're doing all these things. And the way it looks right now is they will be coming back to school in their own little bubble, and that's the way they're going to have to learn. And it doesn't seem like teachers have enough training to deal with the social and emotional issues that we will have when schools open. As far as knowing that school is going to be open remotely and we might close, teachers just have to get really good at teaching remotely. I know some districts have been teaching remotely for years now and they're experts at it, but we have other districts that have not been a one-on-one school with technology, and it's going to be the responsibility of the teachers right now that we do need to learn how to do remote teaching the best way that we can. Even though we know it's not the best teaching for students, it's still the teacher that makes the difference in the classroom and the way that they're going to approach remote teaching. And we could make this the best that we can for our students in the situation that we are in right now.
I would echo what Ms. Peralta shared in that we're just going to have to, it's a new reality, and we're going to have to work with that new reality. We're taxed as educators and everybody who's included here, and that's not just at site administration or even at superintendents, I would say the community at large. We are all taxed with trying to help our kids to understand that this really is a different world. It doesn't look like what it used to look like. I greet every single student, and I'm sure Ms. Peralta does, as well as most teachers. I greet every single student as they come into my classroom. I know that Mr. Teravati does the same thing. I know that Dr. Holmes does the same thing. We greet students as they come into school, and we do handshakes, and we do hugs, and we do fist pumps, and we do all these things. And that's part of what we do to connect with our students, and we can't. And even when we stop doing the online, we're not going to be able to do that. And so we do have to become experts at how we can best engage our students, even though it's just not going to look the same. But we have to plan. It's going to demand even more of teachers who are already working tirelessly. I can tell you most teachers were pretty beat fourth quarter because we are learning not just a new method, but then how do we engage students with those new methods? And it is taxing, and yet it's going to be our responsibilities and the support of site administration and upper administration to give us all the resources to do so, and then to be able to explain to students how it's going to have to look differently. Part of those resources that we've been talking about with you, Representative Grijalva, is some of that is actual dollars, because we're going to need to hire some additional counselors and social workers. Those are people who are needed on our campuses before any of this. And so now, as some of those kids are going into unsafe environments and they've been locked in those environments for months without a lot of help and support, and then they come into a school environment that doesn't look the same as it's always looked, we need more financial resources specifically so that we can address the social emotional with counselors and social workers who have a capacity that most teachers just simply do not.
Thank you. Speaking of resources, I also wanted to ask about anybody that wants to chime in here about plans for making sure that students that have special needs, maybe they're learning English, maybe they have some learning or physical disability. What are some plans to meet those students' needs remotely? Have you been thinking about those, and what have you been planning?
So at Sunnyside, what we've been working on is a plan to bring small cohorts of students, may individual or one-on-one, to receive services either back at a building in a safe way, applying some guidelines. And we're hopeful that even if we stay in this online setting, that there is an opportunity to work one-on-one with students and provide services. I don't think doing this remotely is going to work for subgroups of students. There's got to be some flexibility and ways in which we can provide occupational therapy, physical therapy, work with our students with severe, profound needs, taking advantage of the potential of partnerships with our Department of Disabilities. There's so much need for respite services with our families right now. There's got to be a way in which we can creatively look at our district resources in partnership with the Department of Education and Disabilities, and working on ways in which some of our staff can provide some of those services to families in a physical environment, in a safe way. I do believe it's possible, but I think we have to look cross-departmental, right, and across just industry, right? And we need to look at what are the Arizona services that are out there, and what are the school-based services, and what are ways in which that partnership can actually alleviate some of the gaps in services that have been profound over the last 6 months, quite frankly.
Thank you. So I had another question, I guess, but please chime in if you have something to add, or you've thought about something and you want to add it. It doesn't have to be just me asking questions. I guess my question is so I think yesterday the National Academies of Science, Engineering, and Medicine released a report, and they had a number of recommendations. One of them was school districts partnering with local health officials, and I didn't know what state, what that was like, what going on right now in Arizona, and so what has been the nature of those partnerships? Are those still forming? Have people reached out to Pima County Health, different districts to ask about recommendations and partnering with the health department?
Yeah, so I'll respond, but I'd love to hear what the superintendents think and other people. They have reached out, and we've been working with the Pima County Supervisor's Office. I would say that we have not yet given people enough information, and some of that is because things keep changing. So we work closely with the CDC and the state, and we sit on a state group, in a sense, a collaborative effort that's been put together by the state, by the Department of Health, but working with the Arizona Department of Education to develop specific guidelines. So, for instance, things that or direction that people need is if someone in a class tests positive, what do I do? And what are the specific recommendations in that case? And those are in development based on the CDC, and they will be pushed out to the school superintendents for their use. They'll be based on the science. I think this larger issue, though, is what does it mean to be collaborative with the public health in Pima County? What is the expectation for us to be able to deliver? We do have a school liaison from K through 12, and we have a college liaison. Those are both public health nurses that have been working with the collective groups. But I think that we still have a lot of work to do to ensure that we can, in a sense, give a handbook that says, okay, in this case, if somebody tests positive, this is what you do. In this case, if somebody comes to the school and they're symptomatic, this is what you do. These are the recommendations for how you should determine if somebody's symptomatic or not. And then obviously the superintendents can decide which of those to implement. I think the one thing that's clear is that we need to get early insight into any cases that may be occurring in the school. And that's why this discussion about what's an outbreak in a classroom is so important, because just so people understand, the cases get reported to the state and then we get notified. So it doesn't come to the county and then up to the state. It goes case tested, test positive, goes to the state. Then we hear about, you can see how this could be a real lag here. And so what we want to do is make sure we try to diminish that lag. But I would acknowledge that we still have a lot of work we need to do with the schools.
I would like to chime in and talk about one of the things teachers are so worried about is they feel like we don't have enough answers, like what's going to happen when a student does come in and they're sick. And, there's still a lot of work to be done. That's what was just said. So I can't see how schools are deciding to open in person on the 17th when we don't even have these answers. And a lot of teachers are really nervous about and have made comments about we're just being like guinea pigs. Just throw them out there and see what happens, and we will take down the notes and get the research we need to find out what's going to happen. And that's the number one thing a lot of teachers are concerned about is we want to be in front of the teachers. We want to teach them, but we can't do that if it's not safe to go back, and we can't be used as guinea pigs to find out whether it's safe or not. We need to find out how can we go back safely. We can't just throw people out there. These are lives that we're talking about.
And one of the recommendations from that National Academy of Science report, Matt, and you may have seen that, the last recommendation is the need for accelerated research. And yes. I would argue it's probably not really research, but it's accelerated knowledge about to answer your question and questions like that. Because right now, what we're trying to do is look at the best literature. There's many children's hospitals that have done a lot of work in this space, but it's all, in a sense, I don't want to say it's speculative. It's based on the experience we've had up till now. And for the last months, schools in most places have been closed. So the experience is pretty limited.
Yeah, and it seems like Ms. Peralta's point about teachers being used as guinea pigs in those studies that need to be done or need to be examined in order to figure out what's safe. And so, gosh, it's really tough. Maybe just to wrap up, if there were your top one or two things, if you had lots of money to spend to bring kids back to school safely, what do you think your biggest one or top two needs are? What do you need money for?
Yeah, so that's that's always like every educator's favorite question, right? Like if you had unlimited supplies of money. I think that the answer really just differs just depending on the needs of the time, right? Right now, if we had an injection of funds to support and just so we're clear, I know that the federal government allocated CARES Act money to the state, and it sounds like a lot of money, but when you get that as a district, it's not really a lot of money. It's just a pinch of money to really purchase, disinfectant supplies and really position you as a district to reopen, to buy some computers, et cetera, et cetera. But if we had unlimited supply, I would say first and foremost, in order to get through COVID-19, we need a huge chunk of that money to go towards technology, first and foremost. And technology meaning computers for kids, computers for adults, and definitely computers for some of those positions. We new computers that we don't always think about in terms of like our social workers or counselors, et cetera, because across the board, we just need to increase just our ability to reach children, and technology is our vehicle to do it. So any tool that we can have or any sort of support in that area that would speak to that or that would allow for that would be incredible. The second thing, and Mr. Freed kind of brought this up, is just those additional support services that could be spent on those positions, like additional counselors, like behavioral health support technicians, like social workers. These are folks that we know right now just need to be reaching out to children as often as we can, or as families as often as we can. Someone brought up just this need for respite care. If we could triangulate funds to support that, because sometimes when you have a high needs child, sometimes as a parent, you just need a break. And so that sort of support would be incredible. And if we could, again, triangulate that through schools, that would be awesome. So if I had the two biggies, technology and support services.
I'll just jump in. We need to make broadband internet access free. I mean, it's ridiculous at this age that the competitive marketplace was supposed to solve this years back, and here we are with communities with lack of access to a fundamental basic need of access, and the proliferation of information that people have access to. It's just that divide is at this stage in our nation is just something that shouldn't be happening right now. And so I think unlimited broadband access, and not these little $9.99 plans that give you a little bit of data that you can barely talk on the internet with. I mean, this is something that should be accessible to all families regardless of their income, and I think unlimited funds should really make that a basic fundamental need for families.
Thank you.
Matt, I'll respond really quickly because so this is Jason. You had said two things. So the first one would be money, because remember, my focus is on concern for health, and so mine would be money for being able to test every student for COVID-19 and to do it daily. And so that's the money part. The second one would take probably a magic wand, because I'd also need those results back 15 minutes later, so we know whether we can let our kids in school or not. And so, all kidding aside, right? Truly, that's where I just think we know how exponentially, right? It's not a multiple, but how exponentially this grows. And so I just feel like we're talking petri dish kind of environment when we bring students into schools, that they are then going to contract it from another student. And what concerns me greater is that everybody then leaves that school environment. Although our students believe that we live in our classrooms, we don't, and we go home. And so now we're spreading that amongst family members, and some of those are folks that can't withstand having this in their system. And so those kinds of things, for me, one student in a school population of 800 kids is going to infect a great number of kids and adults that will then spread exponentially. And then we're talking about, now we're closing schools again in an emergency setting while we've infected and potentially killed more people.
Thank you. Ms. Peralta or Ms. Cullen, either of you have any money ask?
So this is Terry. I do, and obviously it's going to be in health, right? Because that's what I do. But I do think strengthening the health infrastructure at the schools through ensuring that there's nursing availability, there's the ability to screen every kid. So even if you can't test them, there's some mechanism put in place that they can be screened for symptoms and for fever, and that if and when there's any concern about someone being ill who's at the school, there's a place where they can go right away. There's a mechanism for them to be isolated. There's a mechanism for them to get home. And part of that is also improved health education. So the school nurses, the school health infrastructure, I think needs to be improved. I think that that's a much longer, long-term ask too, as we move forward in this new environment that we have. Thanks.
I would have to
Thank you.
agree with what others have said. Definitely counselors. We need more counselors in the schools and nurses. Some schools share one nurse with 3 different schools. And when there's an issue, we do have a health assistant there. But we do need nurses at all the schools at a time like this where they can deal with situations when they arise and not having to try to get through to someone at Pima County Health Department and find out what we need to do. We need to have somebody on board who is trained to deal with these issues.
Thank you all. Thank you all so much for participating today. Congressman Grijalva, did you want
Yeah, just to thank you and to all of you. I appreciate it very much. Lessons learned. I think this discussion is very important. That's why we want to disseminate it, because I think there's so many people speaking for schools, speaking for kids, speaking for parents on a political level, and speaking for the function of public education in our country, and independent of knowing the reality of what it is. And I think this pandemic, and we're seeing a good example, and we don't need to repeat the same mistake again, that, you know, there was a rush to judgment to try to revitalize an economy here in Arizona, so we opened up, and now we're having to retrench, and the consequence of that is both economic, but we're also seeing the pandemic at its highest levels in one of the states that leads the country, and the issue with the public schools is, you know, like, you got to open it up because business, it's important to business, and it is. And now the schools become the other part of that cycle. And if there's a lesson to be learned, it's about rushing to judgment, saying that we have to do it because we have to do it. I think everything I've heard today from people that are actually doing education in our community is that erring on the side of caution is a smart thing. Two, that the investment in our schools be made now in preparation for the opening and the function, because it won't be the same. And somebody said that that the schools that the kids were used to going to months ago, returning now is not the same. And the pressures because of the pandemic and because of the economic instability that families are sending their kids to school with are going to be tremendous. And so I think that going the investment in resources, money, to help pave the way, I think is important. To do that planning, that collaboration with communities and others, to make sure that that environment is safe for kids, safe for the people that work there, and safe for the community at large. And so it's a lesson learned. It's an important lesson that I think everybody has to learn. The whole idea about doing this on the fly, we're doing it on the fly, and look what's happened at a general societal level here in Arizona and across the country. The schools are a different thing. This is a special commodity we deal with, kids and students. And I think the pressure has to be on Congress not only to invest, but to localize that investment so that we don't have outcomes being dictated from above. That there is some collaboration, some work as the people that are here today all said, with local communities, parents, as to how it should be done, how we reach hard to reach kids that need special attention, and how we make the preparations from the digital divide to the health monitoring and testing that is required, how we do that. And it's going to require money, and taking care, being safe and providing good safety for kids and for people costs money. And if there's such a rush to judgment right now about our schools, then I think Congress needs to be prepared to back that up and not merely make a declaration that it's going to happen, but also have the resources there for people. I admire every one of you. This is a difficult task in front of you, and it is a task with huge responsibilities. And the expectations are not what they should have been. The expectations now are, what are we going to do, and how are we going to do it, and when are we going to do it? I appreciate every one of them, but the health metrics that Mr. Holmes mentioned and that Dr. Cullen mentioned, critical. The investment in that was mentioned based on the question Matt asked, and the point about guinea pigs that was made by Ms. Peralta, excellent. I think we have to take that into account. And what I heard from every one of you was about community, family, and the kids that you serve, and that was very important to you. So I want to thank you. We're going to disseminate that, share it with my colleagues, but also share it with the community, because I think this is the beginning of discussions that need to occur on a localized level over again, because this is a very important decision. We cannot retrench. We cannot open the schools and then suddenly close them again and put at risk kids and the economics that are required to open those schools. So I appreciate it. Erring on the side of caution and planning and preparation is the message I got, and I want to thank you for that. So appreciate it, my friends. It's been very, very good. And Matt, thank you for putting this together. Appreciate it a lot.